Good day everyone. Today, we're going to discuss all about placental gestational conditions, specifically the placenta previa and the placental abruption. And here are the group members who will present the lesson for today. We have Tolentino Ken, ASUNTO Naomi Ann, FERNANDEZ WINLYN JAES, LIWAG Sunshine DAHIME, and yours truly OREIRO Erica Jane. Now, let's discuss all about placenta previa. So, what is placenta previa? It is a problem during pregnancy when the placenta completely or partially covers the opening of the uterus. Or, in other words, the placenta blocks the exit of the baby.
The clinical manifestation for the placenta previa are abrupt, painless, bright red bleeding, non-tender soft uterus. Presenting part is the placenta and the placenta is larger than the normal. Now, the bleeding begins at the lower segment of the uterine. It is when the placenta wasn't able to stretch to accommodate the differing shape of the lower uterine segment, or the cervix. Now, a small portion loosen up and it damages the blood vessels and it begins to bleed. Now, for the diagnostic, it is usually diagnosed through an ultrasound during a routine prenatal appointment or after an episode of a vaginal bleeding.
For nursing management, we have the acronym PREVIA. P is for position is side-lying or Trendelenburg to allow good perfusion to uterus and also painless bright red bleeding. R, refrain from internal or rectal exam, relax uterus, soft and non-tender, also no checking of cervical dilation. E, encourage strict bed rest and oxygen as indicated, 10 liters of oxygen via face mask and also check for episodes of bleeding. V, vital signs monitoring, fetal heart tone and movement, and fetal lung maturity, also check for visible bleeding that is bright red. I, IV line available and prepare for blood transfusion and also intercourse post-bleeding. A, assessment of blood loss and preventive measures, and check for abnormal fetal position to know if we have to do blood transfusion. For medical management, we have to ask the patient to bed rest 3 days in side-lying position and also ask the following: duration of pregnancy, time of bleeding began, estimated amount of bleeding, if in cup, 240 ml, pain, to identify if it is previa or abruption, color of the blood, bright red, this means the tearing of placenta, and what she had done for the bleeding. Also inspect the perineum, no pelvic or rectal exam, obtain vital sign, monitor urine output every hour, assess hemoglobin, prothrombin time, fibrinogen, and platelet. Determine the placental location through ultrasound, double setup or 2 setup, avoid coitus, have adequate rest, and call hospital for any sign of bleeding. Pharmacologic therapy, we have the IVF for fluid loss and also betamethasone. This is a steroid that hastens lung maturity given to the mother if the fetus is less than 34 weeks. This is given 12 to 24 hours before birth and 12.5 mg via intramuscular.
Now, let's proceed to placental abruption. So, placental abruption is a condition during pregnancy when the placenta separates from the uterus.
So, for the placenta abruption clinical manifestation or the most common symptoms are the following: vaginal bleeding with pain during the 3rd trimester of the pregnancy. So, it also can occur during labor. Next one, we have the pain and contraction that do not relax, discomfort and tenderness, and ongoing belly or back pain. However, each woman may experience symptoms differently, but some women may not have or experience vaginal bleeding that is not detectable, but there may be bleeding inside the uterus. And in addition, for the symptoms, are the abdominal pain, blood in amniotic fluid, nausea, thirst, faint feeling, and decreased fetal movement. So these are the symptoms of placenta abruptio that may resemble other medical conditions. So always consult your doctor for a diagnosis. So for the next one, assessment. Placenta abruptio. First, assess for signs of shock, especially when heavy bleeding occur. Assess if the bleeding is external or internal. Monitor contraction if separation occur during labor. Obtain baseline vital signs. Assess for the time the bleeding began, the amount and kind of bleeding, and interventions done when bleeding occurred if it started before the admission, and assess for the quality of the pain. The next one, we have the diagnostic findings. So placenta abruptio is diagnosed through the following: ultrasound, physical exam, blood test, and fetal monitoring. So if your healthcare provider suspect placental abruptio, he or she will do a physical exam to check for the uterine tenderness or rigidity to help identify possible sources of vaginal bleeding. So your provider will likely recommend blood and urine tests and ultrasound. And suspect that during an ultrasound, high-frequency sound waves create an image of your uterus on a monitor. So it is not always possible to see a placenta abruptio on an ultrasound.
Abruptio placenta. So here is the medical management. Intravenous fluids, IV fibrinogen, fibrinogen determination for detecting disseminated intravascular coagulation or DIC, provide oxygen therapy through masks to limit fetal anoxia. For the pharmacologic therapy, enema shouldn't be administered. Betamethasone and dexamethasone are corticosteroids for accelerating fetal lung maturation. Corticosteroids are considered for administration if AOG is less than 34 weeks, late preterm pregnancy which is 34 to 36 weeks, high-risk delivery due to late preterm, no history of corticosteroid usage during the pregnancy, and no contraindications. For the nursing management, first, for the IV line, make it possible for blood transfusion, routine vital signs taking of the mother and the fetus, fetal heart tone, every 5 to 15 minutes, assist the mother into a lateral position to avoid vena cava pressure, avoid internal exams like abdominal, vaginal, and pelvic to avoid placental injury. Further perform observations for the signs and symptoms of hypovolemic shock due to concealed and heavy bleeding. If bleeding is present, assess if external or internal, its amount, when it began, which is the time, and what did the mother do about it. When abruption happens during labor, monitor the contractions. Moving on to the comparisons in between abruptio placenta and placenta previa. First, the onset of abruptio placenta and placenta previa are both at the 3rd trimester of pregnancy. Bleeding in abruptio placenta is concealed, external, dark red in color, and bloody amniotic fluid, while in placenta previa, it is mostly external, small to profuse in amount, and bright red in color. Pain in abruptio placenta is usually present while in placenta previa is usually absent. Uterus in abruptio placenta is irritable and board-like, which we all call cuvellar uterus, while in placenta previa it is soft. Fetal heart tone in abruptio placenta may be irregular or absent, while in placenta previa it's normal. Presenting part in abruptio placenta is the baby and in placenta previa is the placenta. Mode of delivery in Abruptio Placenta is immediate and cesarean, while in Placenta Previa, it may be delayed and may either be CS or NSD, depends on the fetus size and bleeding amount. Shock in Abruptio Placenta may be moderate to severe depending on the severity of concealed bleeding, while in Placenta Previa, it is usually not present unless there's excessive bleeding. So here are our references for making this flip video and PowerPoint presentation. Once again, we are Group 4 from BSN 24 Sister Leti KUAN presenting the topic of placental gestational conditions, especially in the third trimester of pregnancy, and specifically Placenta Previa and Abruptio Placenta. Thank you for watching.